The number of sarcoidosis cases are rising across the nation, and Black women are facing higher rates than any other ethnic group. Here with me now is Dr. Catherine Bonham. She's an associate professor at the University of Virginia and the school's scientific director of the school's Sarcoidosis program. Thank you for joining us.
Thank you for having me.
So first, explain what it is and why it often goes misdiagnosed.
So sarcoidosis is a disease where the immune system is overactive, and it can mimic a lot of other symptoms of diseases that are much more common, symptoms of pneumonia, symptoms of heart failure. And so many patients come to this diagnosis after months or sometimes years of having symptoms that were unclear, and they finally come to their diagnosis and we get them treated.
So we know that over the years, cases have been rising. What has led to the increase in the disease that was once thought to be rare?
We're getting better at treating sarcoidosis, so more people are living longer with the disease. That's one effect. And we're also getting better at diagnosing sarcoid, particularly when we have sarcoidosis of the heart. And I think that some cases where people may have gone with other diagnoses, sometimes severe diagnoses like pneumonia or heart failure, are now being recognized as sarcoidosis.
Interesting. So we also know the research shows that African American women face a higher risk than any other ethnic group of developing this. Do we know why at this point?
The short answer is that it's still unclear. It is an interaction of the immune system with the environment. So there are some genetic components, but there's also the interplay of socioeconomics in this. And this is a really important field of research, one that I research actively in trying to understand how people's immune systems will interact with the environment around them and why it seems that certain groups of people, particularly Black women, seem to really be getting diagnosed with this a lot more than others.
So break it down for us. What are the symptoms that we should be looking out for?
Most commonly, individuals will have lung problems, and that can be something like a cough or shortness of breath. Sometimes, for people that have cardiac or heart forms of sarcoidosis, they'll have fainting spells, dizzy spells. It's important to talk to your physician about these symptoms if you do experience them. Common things are common, and so you may have other problems at play, but we are finding more of these cases now are sarcoidosis. Things like swollen lymph nodes can be detected on chest x-rays. And then for a lot of individuals with sarcoid fatigue, just feeling really tired and worn out can be a prominent symptom as well.
So what about if you have a lingering cough or flu-like symptoms that may not seem threatening? What are the steps that you should take just in case?
Talk to your physician or your provider about the symptoms you're experiencing. I think red flag things are if you're having fevers, sweats, chills at night, and they don't respond to usual treatments, antibiotics, or short courses of steroids if you have asthma. When those kinds of things are not responding to the typical treatments, then it's time to reach out to your provider, especially, and talk to them about what you're experiencing, because there may be more at play.
And stay with us. We've got more BNC Live right after the break.